Bismillah ar-Rahman ar-Rahim. Investigations in haemoptysis. First line investigations include blood tests, which include full blood count, clotting, and blood grouping, and if systemic vasculitis is suspected, renal function and urine depth with microscopy forecasts are necessary, as well as autoantibodies such as antinuclear cytoplasmic antibody, anti-GBM, antinuclear antibody. Sputum microscopic examination and acid-fast bacillus if infection is suspected. Chest X-ray may show mass lesion, bronchiectasis, consolidation, or an EBM. So after blood tests and sputum, we should do the chest X-ray, which may show mass lesion or bronchiectasis or consolidation or arteriovenous malformation. CT chest should be done prior to bronchoscopy. Before doing bronchoscopy, you should do CT chest to know the site of the abnormality in order to increase pick up at the bronchoscopy. Similarly, a definitive diagnosis such as arteriovenous malformation may be made from CT, obviating the need for the further investigations. Bronchoscopy. Bronchoscopy is used to visualize the airways and localize the site of bleeding, and bronchoscopy may be therapeutic if a bleeding tumor can be injected with vasoconstricting agents such as adrenaline or a catheter inserted for tamponade. Transbronchial biopsy or transbronchial biopsy if vasculitis suspected. Then other investigations of haemoptysis include computerized or computed tomographic pulmonary angiogram CTPA to exclude pulmonary embolism, and we should note better that bronchial artery dilatation may be large enough to be visible on a CTPA. Bronchial angiogram, diagnostic and therapeutic. It's rare for actual bleeding site to be identified. More often, the bleeding site is assumed from visualizing a mesh of dilated and tortuous vessels as what is around a bronchiectatic cavity, usually done during episodic bleeding to maximize the chance of identifying the site of bleeding. Bronchial artery embolization. This is a therapeutic approach to embolize the bleeding artery, usually with coils or glue, and occurs only or done only in a specialist center. And there is a small risk of paraplegia of percent below 1% if the anterior spinal artery originates from the bronchial arterial circulation and is inadvertently embolized. Also, in interview to check or to search for the source of bleeding in the upper airway and the echo to evaluate the pulmonary artery pressure, which sometimes, because sometimes moderate and severe pulmonary hypertension can cause haemoptysis, especially patients on anticoagulants.